and welcome everyone that is joining us or anybody that will watch the recording. My name is RJ Panesi. I work in our Career and Professional Development office here at WGU. Thank you for jumping into the session. We have a fantastic presentation ahead of us, but before we jump into that, just a couple reminders. Again, this session will be recorded and it will be sent out tomorrow. So keep an eye out for that recording. Attached to that recording is a questionnaire. We just ask that you take the time, fill out the questionnaire. We value our student and alumni opinion and value that, so we make sure that you are taking the time. It should take you no more than 2 minutes to fill that out, just a few questions. And then, like I said, the recording will be attached to that. So if you want to go back and reference anything that's covered this evening, you certainly are able to do that. There will be a designated Q&A at the end of the session. So if you do have questions, certainly feel free to post those into the chat, or during that Q&A, you will be able to take yourself off mute and ask any questions that you might have, whatever you are more comfortable with. So feel free to do that. Great opportunity to ask some questions right from professionals working in the field. So from here, what I'm going to do is I'm actually going to pass it over to our presenters. Kim, are you ready to chat a little bit?
Sure.
Floor is yours.
Hi, everyone. My name is Kim Ryan. I'm a physician assistant. I've been a PA since 2002. I've worked with Guthrie. I started my first job at Guthrie at our Robert Pecker Hospital in Pennsylvania, and I now work in Corning. I've been at this office for 17 years. I love being a PA. I love being an APP. I think there's a lot of opportunity out there. Skylar's going to talk a little bit more about our APP specific leadership structure in a little bit, but yeah. I'm going to turn it over to, we'll turn it over to Skylar.
Great, thanks, Kim. Hi, everyone. Thanks for joining us today. My name is Skylar Lewis. I am a physician assistant, and I work in the Wellsboro Guthrie Family Medicine practice. It is a small practice in which we do provide care for all stages of life, so birth till death. I'm very passionate about being a physician assistant and advocating for APPs in general. And thank you guys for joining us today. You'll be hearing from me more in a little bit, and I'll hand it over to Carla.
Thanks, Skylar. Thanks, Kim. Welcome, everybody. Thank you for having us. My name is Carla Mason. I'm a nurse practitioner. I have been a nurse practitioner since 2009, so for 15 years. I've been with Guthrie in cardiology for 12 years now. And I won't divulge too much more about my career because I want to explore that a little later on in the presentation. But thank you for having us.
Carrie, would you like to join in and introduce yourself?
Sure thing. Hey guys, sorry again, my video is not working, but so excited to be on here with this panel of providers. I am one of the senior physician recruiters here at Guthrie. I've been at Guthrie since 2007 and really focused a lot of my time on recruitment and retention of APPs. Really enjoy working with this population of providers, and seeing how the roles have evolved at Guthrie is really, really exciting. So there's a lot of interesting, exciting content in this presentation, and we really appreciate you guys being on here and listening to this.
And I'll just jump in real quickly before I turn it over to Kim. My name is Lisa. I am a new provider sourcing specialist here at Guthrie, just started back in September. Had an opportunity to listen to RJ during a webinar, and it just felt like this was a great alignment to be able to participate, to speak with you all tonight. Happy Valentine's Day, by the way, and glad that we're here and look forward to the team sharing with you and appreciate your time. So I will send it back over to Kim, and Kim, when you're ready for me to, move a slide along, just give me a heads up.
Sure. Hello again. So I forgot to mention, I'm the director of APPs here at Guthrie. And my part is going to be just to introduce you to Guthrie in general. Then Skylar is going to talk to you about some APP specific stuff. And then Carla is going to finish it up with nurse practitioner stuff. So you can flip the slide. So who we are. So Guthrie was founded in 1910 by Dr. Donald Guthrie, and I won't go through all this. You can read it, but he actually designed the Robert Packer Hospital and the Guthrie Clinic he modeled it after the Mayo Clinic where he did his residency. And as you can see on here, our values are patient-centeredness, teamwork, and excellence. And that was it then, and it is now. We are constantly reiterating our values in all of our meetings and all of our strategic plans. It's always patient-centeredness, teamwork, and excellence. And flip. I'm not going to go through all of this with you, but this is our compact, and it has the provider's responsibilities and the organization's responsibilities. Under the provider's responsibilities, it's obviously focusing on our patients. It's leading with integrity, advanced quality of work and patient care. Teamwork, obviously working with others within the organization, and community, promoting diversity. The organization's responsibilities to us and to the community is supporting excellence, giving us and leading by example, being responsive and being communicative, and advanced quality of providing us with the tools and the support to provide optimal care. And again, teamwork from the organization as well. You can slide. And I won't go over this, but I do want to just show the very end on the 2023 as of February 1st. So just a couple of weeks ago, we did come into a relationship with Guthrie Ascension, and Lourdes Hospital, which was previously under Ascension and is now part of the Guthrie Hospital and the Guthrie Group. It's about 1,000, I think, more. 100 more APPs, and we'll come over that. We'll go over the employees in a second, but you can go ahead. So this, I just wanted to show you, we have a very large area that we're a not-for-profit. The 12 county service area, it's actually more than that now that Lourdes has come on board and they're in Binghamton. So we have that area as well. Our workforce, it says here 6,500 employees, but it's going to be closer to 10,000 and about 1,000 providers between physicians and APPs. You can go ahead. Again, just to show you how large our area is, and these numbers are based on the 2021 calendar year, and it's significantly larger now. Go ahead. Some current awards, I won't go over all of it, but as you can see, we won a lot of awards. There's a couple more slides, but our Leapfrog, which is, it looks at the quality and efficiency and safety. And we have our Robert Packer Hospital is most recently our Leapfrog A, and Corning is a B, was an A, and we're anticipating it being up to an A again. We're also given the award for top places to work. And we have won several awards on our medical record, the EPIC system. Again, the same thing, you can read through those. But we won a lot of awards, that's the important thing. And again, this just goes over the Leapfrog and of all the hospitals in our area. So we are in the northern tier of Pennsylvania and the southern tier of New York. And in a pretty rural area up on the top left, it's more in the area of Buffalo and Rochester. You can go ahead. This is our 5-year strategic plan, and I won't go through all of this, but we have many meetings and many of the initiatives that we are currently working on are a direct result of our 5-year strategic plan, which includes the all-in motto. So that's incredible care, inspired caregivers, intensified growth, innovative delivery, and investment in our future. Go ahead. Yeah, this is just to show you that we pretty much treat every body part, everything, every system. And there's a lot of openings in many of them. So go ahead. Here's our structure. Again, the ones in yellow are our hospitals, and that does not include our Lourdes Hospital, again, that we just acquired in February. Some of the other ones, the Guthrie Clinic, we're a little bit different where we have the 6 different hospitals. And then we have the Guthrie Clinic, which is somewhat separate. We're all under the same umbrella, but the clinic is more of the outpatient, more the outpatient realm. Go next. Again, Guthrie Medical Group is our clinic. This is the Guthrie Robert Packer Hospital. It's our main hospital in Sayre, Pennsylvania. It's a level 1 trauma center. And as you can see here, all of the services that we offer, and most of them state of the art, updated. We great, good care. Go ahead, next one. Cortland Hospital is our smaller hospital. It's the most recent one prior to Lourdes that we have acquired. It's 162 beds, and you can see the things that they offer there as well, including a behavioral health unit. Guthrie Corning Hospital, which is where I am, it's a 65-bed hospital. It's fairly new, and we are now a level 3 trauma center. And you can see all the services that we offer there. And Troy Hospital is again in Pennsylvania, it's a smaller hospital. It's a 25-bed critical access hospital. And again, you can see our facilities that we offer. And Towanda, same thing, smaller place in Pennsylvania, is our 21-bed acute care and rehab hospital. And this is just a slide to show you that Guthrie is very much into medical education, and we're putting a lot of emphasis on that. And I know here it mentions fellowships and residencies and some undergraduate degrees, but we're also working on really promoting nurse practitioner and PA students here. We have many NPs and PAs that are willing to be preceptors, and we have really put a lot of focus on that. And we're hoping that if you do join us, to be willing to be a preceptor as well. Good. Again, just adding this just to kind of show you what we offer outside for our group. So we are very much, we put a lot of stress on being diverse. And as you can see here, we have an LGBTQ plus community. We also have an affinity group, the PA and NP affinity group. And another one is the Guthrie Women in Medicine. And that's providers, female providers. And we get together a couple times a year. And we also offer a conference. It's usually very well attended. And our get-togethers are very not work related. It's a lot of just socialization. And it's a great way just to get to know each other outside of the office. Go ahead. So with that, I'm going to turn it over to Skylar, who is our APP primary care lead.
Great. Thanks, Kim, for giving us an overview of Guthrie as a whole. In my role today, I will be presenting a little bit more focused on APPs in general within our system. So just for a quick definition, APP stands for Advanced Practice Providers. Within Guthrie, we really focus that on nurse practitioners and physician assistants. Other organizations also have expanded that to CRNAs and nurse midwives, which is something that we're looking close into doing within our organization as well. Next slide. So the current state of APPs in our organization, this is old data. Just to review, as Kim had mentioned, we had a new acquisition of a hospital in the past month. So this is prior to that data. We have about 252 APPs in the organization. We're about 44% of our total provider complement. And there's 160 nurse practitioners and 92 PAs. As you guys probably know, the APP career growth within Pennsylvania and New York is above predicted average. We have an APP council within our organization. It was formulated in 2017 as a way to have a group of APPs get together, provide insight and feedback to the organization about some concerns and suggestions. And more recently, we have our APP leadership structure, which was approved in this March of 2023. That includes your APP director, which is Kim, who just presented. Myself, I'm the primary care APP lead, which covers family medicine, internal medicine, pediatrics, and walk-in clinics. And then we also have our specialties APP lead, which is Carla, who will present shortly, hospitalists and surgical leads. You can move forward. Great. So the APP Council, to take a step back and talk about that, it's comprised of 12 APPs, NPs, and PAs. They're from both states of Pennsylvania and New York. We also have our APP leads, the director. We have physician advisors, legal representation, recruitment, retention, and our administrative support in these meetings. We meet on a monthly basis. And thus far, since 2017, some of the accomplishments in which the council has made are we've developed that APP leadership structure. We proposed a CME policy change and have successfully updated our CME policy. We've updated our practice agreements. We are working on improving onboarding, retention, and collaboration with our physician recruitment. We've initiated quarterly APP town halls. We've also created or initiated APPs on many committees, so such as our Meta Exec, our Physician Management Council, and our Credentialing Committee. And we've also been involved in a lot of high-level leadership decisions, interviewing, and alignment within the organization. Next slide. This is just a brief structure of the APP leadership. So you can see we have our CEO at the top. That's Dr. Sabani. Then we have the president under him, which would be Dr. Ranzavali. I know these are names that you probably don't need to know, but just to add in there. And then we have Kim as the Director of Advanced Practice. She has her dyad partners of her physician leaders as well as administrative partners. And then our primary care leads and such other leads fall underneath of Kim. Next slide. Some of the leadership responsibilities for the APPs in this infrastructure, we're promoting appropriate utilization of APPs, especially making sure we're working at the max of our scope, and that we are reassuring good communication and teamwork amongst APPs and physicians within the organization. We really focus on making sure we're up to date on all state and national legislative issues. We would like to improve the training utilization of APPs at the department level, and we do partner very closely with recruitment and onboarding for hires as well. Next slide. I think at this time I'm going to pass it over to Carla, who will give you a little bit more information about NPs coming onto the system.
Great, thanks, Skylar. So now I get to talk to everybody about nurse practitioners for those who are graduating and those who may have graduated and are here looking for other career opportunities. I would just like to say congratulations. And so I first want to just start about talking about scope of practice. And scope of practice is really the cornerstone for professional regulation. And so as nurse practitioners, our training, we're trained to assess, we order, we interpret tests, we diagnose, we prescribe both prescription and non-prescriptive therapies. We initiate and manage treatment plans, we coordinate care, and we educate. But the thing that makes nurse practitioners very unique is that we specialize in different areas. So a little bit about my story. So I started my nursing career back in 2002. I did a myriad of stuff in rural Alaska. And when I decided to come back and pursue my nurse practitioner degree in 2006, I worked in the cardiovascular ICU. And at that time of my life, I was very adrenaline driven and I loved critical care stuff. And so my first nurse practitioner degree was an acute care nurse practitioner with a subspecialty in critical care. As life changed, things progressed. I have lived in cardiology ever since becoming a nurse practitioner. I started as an artificial heart coordinator for a few years. And currently working in Guthrie, I've been doing general cardiology, which I absolutely love. It gives a lot of variety and stuff. But as time has gone on, we have started using a lot of non-cardiac primary care medications in the cardiology field, such as diabetic medications. And that really prompted me to think I need to go back and kind of learn a little bit more about this primary care area. And so May of 2023, I completed my postmaster's with my family nurse practitioner. I'm board certified in both, and so that's kind of how I can relate, not just as a nurse practitioner, but as a family nurse practitioner as well. And I really have a good understanding of scope of practice and just making sure that we fall within that. So family nurse practitioners, their scope of practice is very broad. They can care for a wide spectrum of patients throughout the lifespan, just like Skylar said, from birth until death. And it can occur in multiple settings. And some of those settings could be whether it's clinics, hospitals, emergency rooms, urgent care clinics, nursing homes, schools, public health, even home health. You'll see nurse practitioners working in all those different areas. And so who regulates scope of practice? And this is where it kind of gets a little tricky, is because the Board of Nursing typically regulates the scope of practice in each state. They also regulate practice authority. And it's really important that we know this, because not only that tells us how we need to practice, but it ensures patient safety, and it protects our license against, if we practice outside of that, it puts us at risk for legal liability as well as disciplinary action from the board, which could be anywhere from probation to suspension or even license revoking. And so these are all important things to keep in mind when you're looking into different careers and whichever state you practice in. Practice authority, it does vary state to state. So there's 27 states in the United States, including the District of Columbia, that has full practice authority. And that means you can practice independently. New York State is one of those states that has full practice authority, but there's a little caveat that's for seasoned nurse practitioners after they've already worked 3,600 hours. There's also reduced practice authority, which is about 12 states in the US. And a lot of the function is independent. However, there are limitations and directions requiring supervision. And typically that's how you operate in practice and prescriptive information. There's about 11 states that practice very restricted, and that requires full supervision. So Guthrie, spanning 2 different states, New York as well as Pennsylvania, kind of has this unique opportunity, New York being a full practice state and Pennsylvania being a reduced practice state, mainly just outlying prescriptive authority. It puts us at a really interesting thing where it's good, going back to Skylar's discussion about the APP Council and the infrastructure, having representation across both states. Next slide, please. So these are all the current nurse practitioner opportunities, and most specifically, this is for new grads. I won't go through all of them, but you can see there is a wide variety of opportunities in all different settings throughout not just the hospital, but also through Guthrie Clinic. And so this is a great place to work, and I would encourage you guys, if you're interested in any of these, please reach out. Next slide. So here's some advice for new graduates. I think these are really important. A lot of times we talk about things about, where we want to work and stuff, but we really don't think a lot about deal breakers, and it includes professional as well as personal. And it could include anything from, where do you want to practice? Is it inpatient, outpatient? What does your schedule look like? Is it working, certain days of the week, certain shifts, certain hours? You also have to take into consideration call time. A lot of different places offer different clinical support, and that may include physician or provider support, like other APPs in the office. How supportive is that environment? How supportive is administration? What kind of onboarding practice to help support you as you enter into this new role? These are all really important things that you have to look into and you have to ask. Some other things is how do you get paid? Is it salary versus RVU or productivity? What's your patient schedule look like? And also continuing education is really important. That should be looked into when you're looking into different jobs. Sorry, would you mind going back? Sorry, Lisa. Thank you. So some things that our recruiting department offers is they help with resume building. And that's really important. I mean, to make sure as new grads, especially, that you list your clinical rotations and all the different things that you've done. And then as you're preparing for your interview, really kind of take this opportunity, not just to be a good interviewee, but also use this as an opportunity to ask your questions. This is not just whether this job is you're a good fit for the organization, but is this job a good fit for you? And so make sure you ask lots of questions and look at those deal breakers and work those into your interview. Seek advice from mentors. And so your clinical preceptors or the different nurse practitioners that you may work with, or APPs, or even physicians that you may work with at your job. And then be very involved during the onboarding process. And what that means is speak up. Make sure you ask questions. You talk about concerns, because this is going to set you up for how successful you may be in the future. And it also makes sure that you're practicing safe and providing good quality care. Go ahead, Lisa. And so here's just some advice for new graduates that we threw together. The first one is be curious. Ask, ask, ask. Know what you know what you don't know. Whatever you don't know, ask somebody. Don't just guess, ask. Nobody is ever going to fault you for asking what you don't know. Never stop learning. That kind of ties into the continuing education. I'm a huge proponent of this. And so I strongly encourage lifelong learning. Empathy is really important, not just as nurses, but be empathetic to yourself as well. The patients are the center of everything we do. That's something that I would encourage us all to never forget. Get involved in the organization, as well as state, national, professional organizations. This is your opportunity to have a voice, and this is your chance to make a difference. And so these things, I know it's really hard to kind of wrap your head around now, but these are important things that you need to stay involved in, and they'll keep you updated on the different changes that are coming down the line. Advocate for your profession, be a role model, like Kim said. Precept. Practice at the top of your scope. And then just remember, if you have any concerns, don't just bring up the concerns, but make sure you think about ways that you can make it better and offer those solutions. And then last but not least, life exists outside of your job. And so make sure you have a good balance, not just of your home life, but your work life. And think about these as you pursue your next step in your career. Thank you.
Thank you, everyone. I'm going to just go back one slide. Here, Carrie, did you want me to launch into our website and then maybe flesh out a little bit more of those other bullets?
Yeah, that works. If you want to go ahead and click on that, maybe get a little familiar with not only our website, but really how to navigate, if you are looking for career opportunities or considering an organization, what to look for. So this is our career site that is branched off of the general Guthrie website. So if you can see, typically career sites have a lot of really great foundational information about the organization. So you want to make sure you're researching, you're educating yourself on not only the position, but the organization in total. We like to add stuff about the area, really make it convenient and almost like a one-stop shop to again, learn about the organization, the position, and the area. So Lisa, if you want to click on that advanced practitioner opportunities, to give us a list. So our website is designed to just really specifically list each opportunity, and then you can click on each one to dig a little bit deeper. We try to be detailed in a way that we can explain the role, hopefully entice applicants to apply online and want to learn more. We've worked really hard to make sure we're including the right elements to a job posting, and obviously a lot goes into that. Not only what the position is like, the team, the schedule. Typically, we've also added salary, CME details. So a lot of valuable information can be found in a posting. So if you're looking for a position yourself, or you're kind of tooling around, you should feel comfortable at least about what you're seeing on the posting to want to move forward and learn more and really connect with maybe even a recruiter or a provider at that organization. So just some tips to look for, making sure it's a well-established organization. and really, again, going back to what Carla said, understanding your deal breakers and really what's important to you when you're researching a position. So as you can see here, we added some general Guthrie information as well, which is really nice. We're so proud of our history, and we've even have some provider testimonials on here as well. So a lot of good stuff to look through. Lisa, did I miss anything or anything else you wanted to highlight on there?
I think that was great. I think you did a wonderful job. Obviously, you could search in the bar in the field there if you want to just put in family medicine or nurse practitioner. It will sort and search just on those. I just gave you an entire global list alphabetically. And did you want to touch any more on any of these, Carrie?
No, I think
Okay,
it's a
that's
really
good.
well-rounded view. Yep.
Awesome. All right. So RJ, we'll turn it back over to you, and we'll open it up for some questions and answers from our team. Thank you.
So just a reminder to everyone, if you want to post questions into the chat, you certainly can do that. Or if you want to come off mute, you have the capability of doing that now. One question I have, if I may to start, is, during the interview process, or maybe it's even earlier than that when they first, right before they apply, what are some things that you all maybe look for that really jump out to you? So maybe it's something a particular individual does. Maybe it's something they really highlight during the interview process. Any insight that you all might be able to share, I think would be beneficial.
I think when I'm a part of APP interviews, yeah, we want to know about your experience and so on, but we want to know about you. And so we want to see that you're interested, and we want to see that you ask lots of questions. And a lot of it is personality, but we're not just interviewing you. You interview us too. So we want to showcase what we have, but we also want to know what you want, know what you're looking for, but be interested. And again, just ask questions. Be inquisitive. How about you guys?
I was just going to add, this isn't really coming from like my perspective, and Carrie, maybe you can touch base a little bit more on this, but I know that the organization oftentimes does quick little like phone calls, get to know you, who you are, what are you interested in? Why did you apply for this position? To make sure like moving forward before we interview you that you're a good fit and that we've got the right position that you're even looking for to start. And I think that's a great thing that the organization does and offers to kind of partner with you closely.
And I think really looking into the area. And so where we are, we're again in northern Pennsylvania and the southern tier of New York, and we're near a lot of things. And this is a great area. If you like wine and beer, this is the place for you. We're near a lot of wineries. We're not too far from Buffalo and Rochester and even Toronto. We're not too far from Philadelphia. So we have a lot of stuff real close by. We also have Watkins Glen. We have a lot of hiking. We have a lot of skiing. But look into the area that you're interested in.
Come on, you got to throw Wegmans in there too. We gotta sneak that in.
Wegmans is awesome. Is it out where you are?
So I'm in the Hudson Valley in New York. So no, we don't have Wegmans, but my wife lived in Rochester for a number of years, so very familiar with Wegmans.
Yeah.
Wegmans is the deal closer.
Yes. Yeah. You know how many people mention Wegmans for sure. Yeah. Some of the other things I think that's unique about Guthrie, or that we're really lucky, is we have this APP infrastructure, and I'm the first one to acknowledge that a lot of organizations do not have that. We have a lot of organizations around here, just even much bigger ones than we do, that don't have an APP council, that don't have representation on MedExec or our provider management council or other committees and boards, and we are on the forefront of that in this area. And so even having an infrastructure, when we proposed that infrastructure, it was approved with overwhelming support from our physician administration and physician leadership. And our CEO, Dr. Sabani, he's from Cleveland Clinic. He's very progressive. He's very much a champion for NPs and PAs and other APPs. So we're really lucky in that way. We also have a lot of education opportunities regarding leadership. So we have in-person classes, we have online classes, we have lots of things to read, a lot of leadership websites within the Guthrie Internet. And we have more chances and more opportunities for career growth. But I think most importantly is just the support from our physician colleagues. A lot of physician colleagues, even the president up to the CEO to new grads. I mean, it really does foster a team approach here at Guthrie.
Another question I had, especially for new professionals maybe entering the field or even just new to Guthrie, as far as mentorship, can you touch on maybe the mentorship piece for new individuals starting? What does that look like?
I'll let Skylar or Carla answer that. We've been working on this, so.
I can start. So we, starting with the APP Council for the last few years, we've kind of been in the process of working on a standard formalized onboarding process. Because what we found was there was a lot of discrepancy with how new employees, new APPs were brought into the clinics, and not everybody had the same experience. And so we wanted to make sure that they were supported and had all of the tools to succeed in their position. And so we are in the process of doing these formalized onboarding process and timelines and all of that stuff. And we're also looking into a mentorship program. Kim's been spearheading that, and she's doing a great job. Skylar, did you have anything to add?
No, I think that's a great response. The organization definitely values all of our APPs, all of our providers, and we really want to make sure that not only new grads, but especially new grads are getting that time that they have to ensure that they're developing collaborating relationships with their physician partners, and that they have a good sound base in the place in which they're practicing and the specialty or care that they're providing. So that way we can ensure that you feel like you're in a competent provider moving forward with your clinical role for years to come within the organization.
Thank you. Anybody else have any questions? And maybe as people are thinking of them, I do have one more, if I can. Another question that we see a lot, could you touch on maybe any support you provide employees in terms of mental health? Anything specific that maybe Guthrie does to support their employees in terms of the mental health aspect?
Skylar, you want to mention the wellness group?
Yeah, sure. I'm happy to kind of spearhead this. So the organization recognizes that provider burnout is really high across medicine in general these days, and we're working very hard to kind of prevent that from worsening, if not improve it across our organization. One of the things in which we've done is develop a wellness committee or wellness council in which it's composed of multiple physician leaders as well as APPs across the organization. We're looking at data to determine where our current mental health is within the organization and how to improve that. So I think the key takeaway from this is that we do recognize that working in medicine can be challenging. We are identifying ways to improve, and we're most certainly supportive of that work-life balance, which is a great way to improve mental health overall. I also think the organization offers an EAP, which includes counseling services that is accessible with our organization. I'm not sure much more about the EAP, but do you guys have any insight on that?
No, I think that was a good answer. Along those same lines, we have an engagement survey that we do. It's put out by Press Ganey, and some organizations do it, some don't. But it looks at the engagement, or basically your happiness of being within your organization. And so we have put a lot of emphasis in the results of that. And so it's the opportunity for providers and non-providers to express the things that they're happy with, the things that they're concerned about. And then if we see those recurring themes or they're across different departments, we've already created work groups working on various things. And so we really do take into account what the providers and the caregivers have to say, and hopefully provide opportunity for improvement. We'll be sending it out again in April. So, Carla, do you want to answer that question that's in the chat?
Let's see if I can find it.
Want me to read it?
Let's see. What leadership opportunities are available?
So it says, what leadership opportunities
Yes,
are available?
I see.
No, I'm
Thank you, I
reading it
see
for everyone else. So if you want to read it for everyone else so they know what the question is.
Got it.
Go ahead. Go ahead.
It says, what leadership opportunities are available across the organization's medical system for nurses with multiple years of specialty clinical and management experience and non-nursing graduate degrees? For example, MBA emphasis on leadership. So that's a great question. Outside of the advanced practice provider, I'm not quite sure. Kim, I'm sorry, I can't answer this any better. For nursing or non-nursing graduate degrees.
So we have CNOs. We have the head of nursing at each hospital. For the MBAs or for those that want to go on, if you're in an administrative position, for example, my position, Guthrie pays for you to get your MHA. And so I'm lucky that I'm able to do that right now. They're very much on education, and they collaborate with other with colleges around here. But as far as there are nursing opportunities, whether it be a nursing supervisor, whether it be CNO, whether it be the hospital-based nurse, head of nursing. So there are. Anything else?
Awesome. Well, thank you all for jumping in this evening and presenting. For those that might be going back and watching the recording, we will be sharing contact information with the attachments that you had sent over, Lisa. So feel free to take a look at those, and if there are any follow-up questions from those that might be watching the recording, certainly connect with me, and then I can connect you from there. Just a reminder, this was recorded and it will be sent out tomorrow with that questionnaire, so please make sure that you're going in and filling that out. But thank you again, Guthrie team. We really do appreciate you jumping on, sharing about the organization. It really does sound like this aligns with what our populations are looking for. So we're certainly excited to send this out, market this out to our populations, and then hopefully from there, connect you all with some great WGU talent. But thank you for jumping on this evening and presenting. We really do appreciate it.
Thanks, everyone, and good luck.
Thank you, RJ. Thank you,
For
everyone.
having us. Good luck.
Have a good one. Happy
Take care.
Valentine's
Yeah.
Day.
Yeah.
You too.
Enjoy.
Thank you.